Most of the time, you can get the knee diagnosis from the location of the pain. So let's get right into it. Kia ora team, I've been a physiotherapist for over 25 years and the knee is one of my most favourite joints to treat. Now if you get pain at the front of the knee, in and around the kneecap, this is usually a common type of knee problem called patellofemoral pain syndrome, or runner's knee. It tends to hurt under, just above or below the kneecap, that's the patella, and it gets aggravated with jumping, using stairs and running. Around 80% of patients with this issue will have pain while they're squatting. If the pain is localised just below the kneecap and it's exacerbated when you fully extend the knee, then this can be called infrapatellar fat pad syndrome. If the pain is around the tendon, which runs over the patella and inserts into this bump at the top of your tibia, called the tibial tuberosity, this could be patellar tendinitis and will be painful when exercising and when fully straightening or bending the knee. Active kids that are aged between 9 and 14 can have pain on that bony lump where the tendon attaches, and this is called Osgood-Schlatter disease. It's a swelling around the bony growth plate in this location. And a lot of sport during kids' growth spurts will contribute to this issue. If you have injured a meniscus, that's the rubbery shock absorber that cups the knee joint, then you have pain usually on the inside of the knee joint, around that joint line between the shin and the thigh bone. This is usually localized pain. Can cause a locking sensation or a giving way feeling. On assessment, patients will report pain on a deep squat. They usually offload that painful side. But the good news is unless there is a major mechanical symptom like clicking and bad locking that is getting worse, then it can be managed without the need for surgery. If you've injured the knee during a sporting pursuit with the knee collapsing inwards, then you might have sprained the inside ligaments. This is called the medial collateral ligament, or the MCL. On the outside, the lateral collateral ligament is located, and this is injured when the knee is forced outwards. Another structure that can cause pain is the pes anserine bursa. This is a fluid-filled sac, a couple of centimetres below the inside joint line on the upper shin. This creates pain with exercise and some swelling, and it's more common in women and people that are carrying excessive weight. If you have pain on the outside of the knee, the most common affliction is iliotibial band friction syndrome, or ITB syndrome. It comes on with runners and sometimes cyclists and presents with a quickly building sharp pain on the outside of the knee. Most of the time, the main contributing issue to ITB syndrome is a lack of stability around the lateral hip. If your pain is above the kneecap, then this can be tendinitis of the quadriceps muscle. Pain at the back of the knee will usually be one of three issues. If it's a popliteal strain, and this is the very small muscle that locks the knee when it's fully straightened, then you will feel it in the fold in the back of the knee as you flex it. If the pain is further down the lower leg, and it's painful when you complete a raise, then it's probably a calf strain. And if there is swelling or a lump at the back of the knee in that popliteal fossa, then this is called a Baker's cyst, and is usually indicative of some pathology within the knee, such as a meniscus tear. As always, for more help, seek the guidance of a trusted sports therapist, and preferably one that has a real interest in running. Otherwise, get out there, get strong, earn your miles, champion compassion, look after those knees, and I look forward to catching up with you on the next one.